name is Ruby from the RubyGarmaNetwork.com. Today we're gonna talk to Ashley Balbas. She's gonna tell us about her experiences from school to being an RN. Hello, Ashley. How are you doing today?
Hello, I'm doing good.
Okay, go ahead and introduce yourself.
My name is Ashley Balbas. I'm a registered nurse. I've been working in the ICU now for about 1.5 years. I got my license back in April of 2021, and I've been working since May of 2021.
What school did you go to for your RN program?
I went to El Camino College in Torrance. It was an associate's degree program.
How was that program?
I thought the program was good. There are a couple flaws were just organization. But other than that, the teachers and the staff are really helpful, and I feel like I learned a lot from them.
So I believe you were in the middle of the pandemic when you guys are supposed to go to the hospital. How did you guys do that?
So one of the students found we couldn't go to the hospital in the beginning. So for my whole third semester, we had to do telehealth for our clinicals. We went online, did simulations online. And we also volunteered to do COVID testing. And at that time, the BRN approved it as clinical hours. So that's what we used during that time.
Okay, so
Mhm.
you were able to complete from the medical surgical all the way to OB,
Yes. Oh,
basically.
yeah. OB, I had to do all online as well.
Oh,
Mhm.
okay. That, that was probably tough.
Yeah. It was a lot of long hours on Zoom and just, doing like online simulations. And I wish I got to, see a C-section or like something like that, but
Oh,
it's
wow.
something that I didn't get to see
Yeah,
during
so
nursing
you were
school.
not able to see an actual delivery.
No,
Oh,
nothing.
okay.
Yeah.
And but did you have to take care of a real patient in like the pediatrics?
I did.
Oh, okay.
Yeah, I took care of a patient that was she was a baby,
Hmm.
failure to thrive, and I had to feed her, give her medications. I thought it was a good experience.
Oh, okay. How do you study for NCLEX?
I used UWorld, and I also utilized Mark Klimick lectures. He teaches classes on test taking strategies for the NCLEX. So I just listened to his lectures and I took notes, and then I did practice questions every day on UWorld just to get
How
myself
many,
involved.
yeah, how many questions did you do for our audience to know? How many exactly?
It was over 1,000 practice questions.
Okay,
Uh-huh.
but did you do like 100 at first and then you went to 150 and then went up on a daily basis, or just do as much as you can?
It was divided into sections, like peds and stuff like that. So
Mm.
I would divide that the amount of questions in that section into how many days I wanted to spend. So I would do about 75 to 100 questions per day.
Oh, okay. That's a lot.
Yeah. It was a
But
lot.
did you also work outside of y- outside? Did you also work while going to school
I
at El
did.
Camino?
I worked at Starbucks during the time. I was working about 20 hours a week in addition to going to school.
Was that hard for you, or?
It was very difficult. I had a lot of early shifts and then I had to come home, study or go to class. But I made it work.
Did you do a lot of partying?
No, no, not
Okay.
not during that time. And I was like, I need to get through nursing school and I have to make sacrifices somewhere.
Correct. Yes. Now you said that, let's go back to your specialty. You started as an ICU nurse, or did they start you at the medical surgical?
I started in the ICU. Um,
Okay.
I knew that being a new graduate nurse, it was already going to be a steep learning curve,
Mm-hmm.
especially since I missed out on some clinicals because of the pandemic. But I felt that I was, up to the task and I could just continue to study what I see in the hospital and, hone my skills in that sense.
From the school, when you graduated from the school, El Camino, how long did you wait to take the NCLEX?
I We submitted our paperwork back in December, but we didn't get a test taking date up until I would say March, and then I took my NCLEX in April.
Okay.
Yeah.
So I always like to remember the teachers or whoever supported you during the RN program. Do you remember their names?
I do.
Oh,
Yeah.
okay.
I had a lot of good clinical professors
Hmm.
that I was thankful that they pushed me so hard in clinicals and they gave me all these opportunities because I utilize it a lot now and I
Yeah.
see why they made like medicate passing medication so important, like knowing your six rights, and those are things that I carry on and do daily.
What about doing care plans? Did they push you to make sure that you know how to do it?
Yes, care plans were the biggest pain during nursing school. They're very tedious, but I understand, why we do care plans. We still make them at work, but now it's just clicking buttons instead of
Yeah,
writing it out.
it's already pre-made,
Yeah, it's
right? Yeah.
pre-made.
I think that was the hard part for me as well because before we go to the clinical setting per se, we have to go the night before to get our patient, and then we have to do a care plan and submit it to our instructors. I'm not sure if they did the same approach.
Yes, we had to go to the hospital the day before, choose patients, look up all
Hmm.
their medications, and then you would hope they didn't get discharged the next day. But if you
Yes,
did, you would,
otherwise you have to do another set of patients,
yeah,
right?
all over
Okay.
again. That was the hard part. But
Do you have some experiences that when you're reading the medical charts of that particular patient and they put a GSW or an abbreviation that you didn't even know what it is? How did you do it?
For the most part, I could kind of figure out from the context of the notes on there, like
Hmm.
what it was trying to say. But there were some times where I had to Google it because
Yes.
it's another language.
I'm not sure if we even have Google then. That was 20 something years ago, but maybe. But I think what I can relate into that is because we used to work um, practicum at General Hospital,
Hmm.
and there were a lot of GSW, and I didn't understand what was the GSW, so it's a gunshot wound.
Yeah.
And everybody was just like, what is that, and you have to make sure that you look at, make sure that you have to take care of that and so forth. So but it was fun, isn't it,
I
for going to school and doing the practicum part. I think that was one of the best experience for me. What about you?
Yeah, I really enjoyed, like, you get really close to your clinical group
Hmm.
because you're all going through the same thing and struggling together. But I liked, meeting all these people who have similar, backgrounds and like similar things that they want to pursue. Because you all have like a sense of teamwork
Hmm.
when you're in the clinical setting, and that's what I really like.
But why nursing for you? Why did you want to be a nurse?
I always enjoyed like healthcare really fascinated me. But I like that nursing is multifaceted. Like there's so much you can do as a nurse. You can work bedside, you can do aesthetic nursing, you can become an educator. You don't have to stay in one position. You have the ability to move to a different unit if you're tired of something. And I honestly like caring for people and I like being for their there for them in their hardest moments. It's a really good like I don't know, that feeling in your heart, that it just makes it full, like you're actually helping someone. Um,
Is there anybody in your family that is a nurse or
uh,
in the medical field?
I do. I have a couple aunts that are RNs as well. Um, And my mom also works in the medical field, and I think that's what kind of influenced me too.
Yeah. Um, Now that you're still in the newer phase of, I call it a newer phase of the nursing experience, what is the best experience for you going to school as an RN student?
I remember I had the opportunity to see a below the knee amputation, and I was in the OR with them for like 6 hours.
Oh, wow.
So I got to see everything from beginning to end, and I think that was one of the best experiences. I got to see it, like, not just on screen or on TV. I got to see how the whole OR works, how the anesthesiologist works with everyone.
Did
So
you guys do the scrub first before you went into the
yeah,
OR? Yeah.
yeah, I had to scrub for a very long time. I was like, how do you guys do this every day?
Oh, wow. So how many
Yeah,
students did they let in the OR?
it was just me that day.
Oh,
Yeah,
okay.
so we each got to go, one student each clinical day. One
Hmm.
of us got to go to the OR during my med surge rotation.
Okay. Oh, that's good. So what about work? Now that you're working in the bedside, what is the best experience that you have so far?
I had a patient who was really critical at one point. He was on multiple vasopressors, intubated, and he had to get emergency dialysis. Um, and he actually came out of it. We worked really hard to stabilize him. And many months later, since I work in a long term acute care facility, I kind of got to see him progress, where he just started doing PT. He was off dialysis. He was talking again. His mentation was back, and he got to walk out of the hospital. And I think that was one of the best experiences I've seen.
Yes. We, us nurses, that's true what Ashley is saying though. I think that was part of why I also choose to be a nurse. Because if I see my patient alive when I leave the hospital or when they go home, it's a relief, isn't it?
Yeah.
Yes. Wow. Okay, that's a good experience. So you are very compassionate. Do you think that all the nurses that you work with are compassionate in a way?
I definitely think that some people have more compassion than others.
Oh, okay.
And I see that also some people just see it as a job that they have to do,
Hmm.
which I think it only adds to the negative effects of patient outcomes. Because if you don't really care about your patient, you're just being, task oriented and not really thinking like long term for your patient, then they'll suffer.
Okay. I believe you kind of mentioned you were you were working in the midst of the COVID-19. How was that experience?
I think it was scary at first, just knowing that we were still unsure with vaccines and like other things like that. And I had to wear full PPE every time I went in there. I was scared every time that I was going to get COVID after going into my patient's room, but I knew that I still had to go in there and take care of them to the best of my ability.
Were very scared?
Yeah, it
Oh,
was
okay.
scary at first. Just because my brother's immunocompromised and I don't want to have to, bring it home with me.
Hmm.
Yeah, I think
So
that's the
did
main
you have
part.
to take care of patient that was COVID positive?
Yes,
Oh,
yeah.
okay.
There was a one point where all of my patients had COVID, like four of them, and I had to
So
take
there
care of
was
them.
also time that you didn't have PPE, or you guys always have PPE?
There was a little bit of a shortage. By the time I got to the hospital, most of that was resolved. We had a lot of PPE people donated, so we still had that
Okay.
stockpiled.
Wow. Okay. So we talk about the best experience at school and at work. Now I'm gonna ask you, what's the worst experience that you had in school,
Mm, worst experience? I think it
if you
was.
can remember?
I think it was just like the really long days. Like there was a time where we would have classes up until like 7 p.m. and then you have to study and you have to come back to clinicals the next day. It was just the really long days of studying and like having to do so much for your clinicals and all that.
Yeah, as if there's no.
Nothing else I have to do.
Yeah. Yes, I felt that way too before. So what about work? What is the worst experience that you can remember?
I think it was one of my first times off of orientation. I never experienced a code at all during my orientation. So I think it was like a week after I got off orientation, I had a patient that coded during dialysis. And it was my first time doing CPR. And then, this patient, we brought him back, but he kept coding. And it wasn't until 7 times later that he finally passed away.
Oh, wow.
Yeah, so that was a really rough day for me because I was like, this is all still new to me. But luckily, I had my charge nurse to support me and all my other coworkers that were helping me. But I think it was just a really tough day because I had to interact with the family and tell them, unfortunately, your family member didn't make it.
Yeah.
Yeah, and that was the tough part for me.
Yeah, the steps that you have to take after
Mm-hmm.
they passed away. I think that was the not um I would have to say that's the worst thing that I have to tackle. I didn't like telling the family that their loved ones didn't make it, because it's hard. It's hard in my heart.
Yeah.
So I used to say I keep praying that all my patients will still be alive. When I go back the next day. So, do you guys work 8 hours or 12 hours shift?
We work 12-hour shifts and I work day shifts, so 7 to 7:30.
Okay. So far, your experience with going through school and now starting your career working in the bedside, are you planning to go on a higher level of education?
I do. I'm completing my bachelor's right now at University of Texas.
Hmm.
And then I plan to also pursue my master's. I'm not sure yet, maybe NP, education. I'm still trying to see as I gain more experience, like where I want to land. And then hopefully get my DNP after.
Oh, wow. That's good. That's well, I commend you for doing that because I think some of the nurses, once they became or become an RN, and that was the end of it. But I think I would encourage everyone to go higher if they can. So, because there's a lot of opportunities out there. So, do you remember any teachers that made a difference in your RN programs? And if you do, you can say their names. Maybe one day we might be able to interview them and learn, how they motivate students to be successful in the RN programs.
I did. It was my last clinical instructor. Her name was Rebecca Weber. She was just a very nice and understanding clinical instructor. She was hard on us at times, but it was for good reason. And she wouldn't really scold us on things. She would try to turn it into a teaching opportunity, like not just like you did this wrong. It's like explaining to us like how things are working. And I think that a lot of us respected her, and that way we did well in clinical because we knew that she would support us, and it was okay to make mistakes still because we're still learning. Um, but we knew that we had to still be up to par on everything that we're doing during clinical.
Yes. Yeah. Any mentors at work?
I do. I have a lot of mentors. My preceptor, who I had during orientation, she's been a nurse for over 40 years. And she really taught me how to take care of my patients, like make sure they're clean and tidy. And then she also helped me push me on my critical thinking and helping me think on my own. And also, if I have any questions now, I feel like I can always go up to her and ask her. No problems.
Oh, okay.
Mhm.
So I think right now you're an ICU nurse, but do you also take care of medical surgical patients or
I
on the floor?
I do. I was cross trained to do medical surgical if they need to float me if they're
Mm-hmm.
short. The biggest part is just that your priorities are a little bit different on a medical surgical floor since you have 4 patients to go see. They're not as critical, so most of the time their vital signs are stable. So it's more about like time management and making sure that everyone is looking nice and clean.
Okay. Does the employer or hospital, do they follow the nurse to patient ratio?
At my hospital, we are very short staffed a lot of the times. There's a time where I've had 6 patients and no CNA
Oh, well. So you
or
guys have to do everything.
everything. Yeah. So we'll do TPC, total patient care,
Hmm.
vitals, everything on our own. Very tough day. Um, Also, there was a time where I had 4 ICU patients to myself because we were short staffed as well. So out
Wow.
of ratio.
That's I think part of it is also questionable patient safety, but it's not always a perfect environment. Like what you said, I remember having 8 or 12 patients in a medical surgical, and it was a I wanted to say it was really hard. It was
Yeah.
really hard
Like, how do
because
you
you're
see
the
that many
one that does
patients?
all the assessment, documentation,
Hmm.
and we only have a CNA because they didn't employ LVN then.
Oh.
So we had to do everything.
Hmm.
But at that time, we also did paper documentation. It
Oh, that's
was
hard.
not digital yet or EMR. So I think you guys have it easier now.
Yeah, in terms of
Yeah.
charting.
So basically, right? So we're closer to the end of our questioning. I know you renewed your license. The first time you renewed your license, you don't have to have the CEU, right? So now that you renewed it, how much did you pay and how many CEUs? Can you tell the audience?
I think I paid $180 to renew my license, and then they require 30 CEUs, I believe.
30 CEUs.
Hmm.
Oh, okay. So where did you get your CEUs at?
I had the opportunity to precept a nursing student from Long Beach City College, and they awarded me a CEUs for all the hours that I precepted her.
Oh,
Hmm.
okay. That's good to know.
Yeah,
I didn't have any knowledge of that. So that's very good.
yeah. It was like I'm at work already. I'm earning my CEUs. It worked out.
Yes. So who's giving you the CEU? Long Beach College or your work?
Long Beach City College.
Oh,
Hmm.
okay. Oh, okay. That's good to know. Okay, so we're in our last question. What do you want the aspiring nurses to know about being successful in the RN program? So, what is your advice?
My advice is to study very hard. And it's just, staying organized and setting a time that, time aside to really just sit down and read your books, make flashcards, answer practice questions. That is my biggest advice. It's the most helpful. And read all your rationales. Yeah.
Yes. Thank you, Ashley, for doing this interview. It's really a pleasure, and I'm glad that you were able to do it with me. So, welcome to the Ruby Garma Network.
Thank you for having me.
If you like this video, give it a thumbs up, comment, like, and subscribe, and see you on the next video.